Steve, the Association of Colleges holds an annual conference just for health and safety issues. Why is this such an important area for colleges?
Well, I think it's important from three particular reasons: the legal, moral and financial dimensions. A college could obviously be fined and lose lots of money. It could put off potential learners, or their parents might not want to send their precious youngster along to a college that was seen to be injuring them. And of course there's the threat of legal cases and the bad reputation in court. So from a number of different reasons, it's wise for a college to be well set up in health and safety.
We hear a lot about violence in schools and colleges from news in America, but how real are the risks in the UK?
Well, thankfully I think it's a perception problem. The number of actual attacks in colleges is very, very small. Of course, we shouldn't be complacent. IOSH already has a raft of measures in place. We've got workshops on dealing with violent intruders, dealing with people with knives and weapons, and also the power to search. So by having those things in place already, we hope that the problem can be dealt with before it arises, so nipping in the bud, so to speak, and colleges can be seen, as we wish them to be seen, as places of safety, much more safe than, for example, out on the street. And we hope that that will start a sort of snowballing process, that the safer a college appears to be, the less likely somebody will be to bring a knife in for their own personal safety. So we've got measures in place, and I think all colleges are moving towards dealing with it effectively.
There was a session in today's conference about counter-terrorism. Is this an issue that colleges need to be concerned about?
Well, sadly, yes. Since 9/11, I think the whole landscape has changed in terms of the threat that's posed from outsiders, or in the case of students, insiders sometimes. So I think colleges, to be responsible, need to bear this in mind, and the guidance that we've just produced with NaCTSO lays out measures the colleges probably already doing, but maybe it reminds them of the steps they should be taking and areas of the college they need to be protecting in particular, and also the measures they should take if, sadly, an incident like this happens. So it's just really putting it up in people's minds the possibility that this might happen, and the boxes that you should check to make sure that you've dealt with the potential as appropriately as possible. So I don't think it's a large threat. I don't think colleges are the prime target for terrorism, but it'd be terrible if something happened and the college wasn't prepared, and that's really the reason for the guidance.
Do you think it's important for colleges to communicate what they're doing to protect students in terms of terrorism, security, safety, back to parents and guardians as a PR exercise?
I think yes. It's funny that PR is sometimes underestimated in terms of this health and safety dimension, and it's, I think, very helpful for a parent to feel that the college is a safe place for their precious child to go to. So the more we can send that message out of reassurance, the better, certainly.
Another key health and safety issue for education is slips, trips and falls. Why is it such a problem?
Well, it's interesting. It doesn't sound like a sexy topic like a chemical explosion or something, but the facts are that although not everybody works in high voltage electricity or dangerous chemicals, everybody walks about. So the potential for it to happen, or for an accident to happen, is very high. So we need to keep it upmost in people's minds, the fact that it could happen. So standing on the swivel chair just to do a quick job is something they shouldn't do. And of course the spin-off in terms of what people do at home is also quite important. If you're mindful of health and safety at work, then of course you're more mindful of health and safety at home. And there are lots of accidents, sadly, in that sort of area in domestic situations.
The education sector is often accused of wrapping children up in cotton wool. What do you think that health and safety professionals working in schools and colleges can do to change this?
That's a very good question. Health and safety professionals, in a way, had bad press on this one, the conkers bonkers syndrome. But in fact, what a health and safety professional would tell you is that we need people to become intrinsically safe. In other words, to be able to do a sort of unconscious risk assessment of what could happen when they stand on that swivel chair, or reach too far, or don't wear the goggles. So rather than have health and safety imposed on a person as a police officer or a parking warden would do, it would be great, and that's the aim for health and safety professionals, if people themselves, learners and staff, had this inbuilt safety, so they were guarding themselves against potential risk. So it's teaching people to move in that direction, I think, is the holy grail for health and safety.
Thanks for your time, Steve.
Pleasure.